Hi, welcome to Nutritional Meds. My name is Dr. Cyrus Thomas, and I've been a chiropractic physician for 34 years. I also have been doing blood tests and hair analysis during this time, and so I'm actually a chiropractor that works a lot like a naturopath. Today we're going to talk about cardiovascular health. Now, cardiovascular used to be an area where a lot of people were somewhat taken advantage of because they didn't know enough about cardiovascular health to be able to make decisions and would just do whatever doctors told them to do. One of the purposes of this show is to educate you so that you can make informed decisions when somebody says, oh, we need to do surgery by Monday, you need to have a CAT scan, we need to do an MRI, whatever it might be. Nutritional medicine by lab analysis. So we use laboratory analysis to practice medicine by using nutrition. So you can practice medicine by using nutrition or by using pharmaceuticals. I also am a diplomat of the National Board of Homeopathic Examiners and a medical doctor of homeopathy from India. Now, cardiovascular health involves nutritional remedies that do work. We have about 50 years of documentation to show that all kinds of substances work for cardiovascular health. Medical analysis, nutritional treatment. The biggest causes of cardiovascular poor health are weight, poor diet, and that poor diet is mostly in the form of too many carbs, corn syrup, flour, and soda pop. Smoking cigarettes with additives. I mean, in some states, up to 35% of the population is smoking tobacco with additives. If a person is going to smoke without additives. Caffeine can be a problem for some people. Deepak Chopra has recently stated that up to 4 cups a day is okay. Other people will find out that that doesn't work for them. And aspartame, the artificial sweetener, has been implicated in cardiovascular accidents. The goal of natural medicine is to prevent collateral damage, using science combined with natural medicines to help facilitate the body to heal itself. We do the labs, we know what's wrong, we recommend the nutrition and the diet, and then we recommend supplements to go with the diet so that this food becomes as nutritious as it used to be 300 years ago. 100 years ago, before we began to adulterate all of the products we eat through modified agriculture. Supplementing food makes food the way it used to be. The life stressors, the top 5 are work, diet and health, toxins, financial worry, emotional relationship issues. That's certainly 5. A lot of people worry about money. Money is a terrible one. It takes sometimes 6, 7 decades before we learn how to view money correctly. There's a lot that we can read about that. At the workplace, not very many of us are doing what we want to be doing. Instead, we're doing what we have to do to make a living. The object is to find out what you want to do and then be someone who's actually doing what they want to do. A lot of people think that doing nutrition is just way too expensive and that they can't afford it. Not really so. When you buy good food that is simple, you've eliminated a lot of processed food, so you're not paying for the processing. You buy carrots and broccoli and fish and meats and cheeses and dairy and fruit. You're not spending actually that much on your food. If you begin to supplement with buying nutrients, now the cost, of course, will go up, but it's because the quality of your diet has gone up in proportion to the amount of nutrients that you're adding to your food. Cardio truths. Iatrogenic kills more people than any disease. What is iatrogenic? It's hospital or pharmaceutical, or which is pharmaceutical, or allopathic doctor induced. An allopathic doctor is one who prescribes pharmaceuticals. Iatrogenic kills more people than any disease. That is, the mistakes made in hospitals and the side effects of pharmaceuticals are actually killing more people than any disease. We have to begin to think about this. We have to begin to start talking about this. Cardiovascular used to be 2/3 of all deaths. Now cancer equals it. So the amount of medications needed to do chemotherapy in cancer have made it so that cancer actually makes 5 to 10 times more money for the medical industry than cardiovascular does. Cardiovascular used to be the cash cow for the Hospital Owners Association. Now it's chemotherapy. 9 to 10 will develop hypertension. The lifetime risk for the development of high blood pressure is 90%. 60% will receive medication. This public health burden will likely increase as the U.S. population ages in the near future. Hypertension is greater than 140/90. But let's be clear about something. In India, and I've worked in the hospitals there, a lot of people are walking around with blood pressure of 140/90, 150/100, and they're perfectly fine. In this country, we have been told that this is bad, that we'll blow a blood vessel and we'll have a stroke, and so we need to take medication to keep the pressure down. For most people, blood vessels will not rupture until you reach about 225 on the higher end, and that's the amount of pressure right after the heart pumps. Then in between pumps, the pressure drops all the way down to 90 here, and then the heart pumps and the pressure goes back up to 140. So that's all that systolic and diastolic really mean. And the different numbers tell us about, how clogged an artery is or how elastic the wall of the artery still is. And we want them to remain elastic. Nutrition can do that. Good nutrition. Cardioanatomy and physiology. There's 5 quarts of blood in the body. 40% of that 5 quarts is red blood cells. 60% is clear fluid. 1/2 of the heart pumps to the lungs. The other half of the heart pumps to the body. Cholesterol is the slipperiest substance known to man. So one of the reasons why the heart pressure increases is to be able to push blood through all the capillaries at the far reaches of the body, the places furthest from the heart. A capillary is as big as a red blood cell. To push that red blood cells through, you need a certain amount of pressure. As we get older, we lose some elasticity in our blood vessels. We also get some hardening of the arteries from calcium and other factors, and it becomes harder to push the blood through the blood vessel. We need to keep the blood pressure up to a certain degree, and we need to keep the cholesterol up because it is the slipperiest substance known to man. And it's the oil of the blood. So if we lower the cholesterol with statins and we lower the blood pressure with blood pressure medications, what are we doing to the person? We're removing their oil and we're not pushing the blood through the capillaries. I think this is a grand mistake that medicine has been making now for some 60 to 70 years. And then in the next 20 years, probably, people will begin to talk about this and they will begin to rethink this. Blood pressure does not have to remain high. Diet can clean out the arteries and lower blood pressure. Also, we can regulate through good diet and nutrition the different types of fats that a person is getting in their nutrient regime and diet, and we can regulate the lipid profile of the blood. And by doing that, we can control the cholesterol completely. What is an EKG? An EKG is a device that measures how well the electrical signals are flowing through the heart. It tells you about the electrical system, does not tell you anything about blood pressure or how elastic the arteries still are. Exercise and recovery time. The best way to judge how well your heart is doing is to do some exercise, get your heart rate at the end of the exercise, wait 2 minutes, get your heart rate again. What is the difference between atherosclerosis and arterial sclerosis? Atherosclerosis is essentially the clogging of the arteries. Arteriosclerosis is the hardening of the arteries. The elasticity of the arteries, the bolus, and the free radical damage to the vessel wall. What we're talking about here is that we want blood vessels to be elastic so that they can expand when the heart pumps and they can contract after the blood flows through, which actually acts like another heartbeat. That blood going through is the bolus. Free radicals are chemicals, mostly from our food, that tend to injure the walls of arteries. When an injury takes place in the wall of an artery, it swells. When it swells, the blood can't flow past it as easily. So cholesterol begins to collect over that swollen area because it's the slipperiest substance known to man. That's a good thing. But if it continues and it goes on for too long and the wound underneath the cholesterol doesn't heal, that artery will clog and eventually stop the flow of blood going to wherever that blood went to. That can be a big problem. So we have to take care of our cardiovascular problems while we're still young. When a patient has seen numerous doctors with no success, go back to the basics. The basics are blood tests and the cardiac profile. We also do a lipid profile. We look for heart enzymes such as SGOT. We measure the blood pressure. We look at the pulse. We use a stethoscope to hear for any murmurs. We use EKG to understand the electrical flow around the heart. And we look at inflammatory markers to see if there's inflammation and swelling anywhere in the cardiovascular system. There are different types of cholesterol. They're very low density lipoproteins. They're made in the intestines and the liver, and they're made to carry fats to the body. They carry mostly triglycerides. The LDL is known as the bad cholesterol. The low density lipoproteins originate when fat is lost from the very low density lipoproteins, changing the density from very low to low. LDL is the primary carrier of cholesterol in the blood to the organs and cells. And HDL, which is known as the good cholesterol, are the large, dense protein fat molecules that pick up used or unused cholesterol and take them back to the liver as part of the recycling process. The liver then converts the cholesterol into bile acids, which are then eliminated. The HDL is the most protective form of lipoprotein. This balance between the different lipoproteins can be done easily through nutrition and is much better done and much more healthily done than it is through taking of statin drugs. The size of cholesterol. Now there are tests to measure the LDL particle size, but your doctor can usually predict whether you have small, dense LDL particles based simply on your levels of triglycerides and HDL. So although many cardiologists are doing studies of the size of the cholesterol, it's actually quite a waste of money. And we can tell what the size of them is through the levels of triglycerides and HDL. The heart never stops. It has two livers involved with it, SGOT, it's a liver and a heart enzyme. SGPT is a liver enzyme, but can be from any muscle in the body. We look at C-reactive protein to see if the heart has got any inflammation. And we look at GGT to differentiate liver from bone, because GGT is mostly from bone. Alkaline phosphate is mostly from the liver. Alkaline phosphatase will be mostly from bone. So this is what we look for when we do blood tests. LDH, lactate dehydrogenase, is an enzyme. It's a marker of myocardial infarction. Following a myocardial infarction or a heart attack, levels of LDH peak at 3 to 4 days after the heart attack and remain elevated up to 10 days. LDL is a marker that says a heart attack has taken place. LDH, rather. Stopping medication. No one needs to be told to stop their medications. The stopping of medications or the reduction of medications is something that should be done gradually over time under the supervision of the physician who prescribed the drugs and under the supervision of the person who is treating the person in an alternative way so that they don't need the drugs. It has to be watched by both. This is a case history of a patient who weighed 230. He was 30 years old. His presenting symptoms were eczema, chronic fatigue, allergies, skin problems on the feet, elbow, and legs. The skin problems developed 6 years ago. The patient works as a machinist with a lot of solvents, specifically naphthol. Chronic fatigue syndrome, eczema on the feet, elbows, and legs, which developed at 6 years of age. His allergies, he has allergies, and he presented on 1996, a while back. This patient was a walking heart attack with a coronary risk of 11.8. His total cholesterol divided by total high-density lipoprotein and an HDL of 17. His blood was like sludge, and he didn't even know it. So his ratio was 11.8, and his HDL was 17. That's very low. That should be up around 60, 70, especially for a person who exercises. Within 2 months on the program, his coronary risk had improved from 11.8 to 6.9, and he continues to improve. His energy, sleep, and digestion are improved. Skin has cleared up. His weight loss is 25 pounds without even exercising. His attitude and mental abilities have improved. He's had no flu or colds. Now, why did his weight decrease 25 pounds? Well, as soon as you start to eat better, you can begin to lose weight. We were talking earlier about the cost of nutrition, changing one's diet, and supplementation. It's not that great a cost, especially changing the food that one buys in the grocery store. Adding nutrients to it simply returns the food to the way it used to be 100 years ago. This is all very important information. Blood tests, to do a blood test, a full blood test, a urine analysis, and a hair analysis can cost about $490. And that would be pretty standard in any laboratory. So that's what you can expect for a full blood labs. This is the blood lab of 52 substances, and we use a much more narrow range of what we call healthy as compared to what values are on either end of these for most laboratories. People will have values that are in the beige areas here, and they'll feel terrible, but they don't know why, and their doctors tell them that everything is normal. Well, it's not really normal. To be normal, you need to be in here. We need to be more strict about what we call healthy. A hair analysis is great for measuring heavy metals in the blood and toxins, because each hair follicle actually has an artery and a vein going to it. And so the hair is made out of substances in the blood, and the body uses the hair to get rid of arsenic, mercury, lead, tin, cadmium, and other heavy metals. It's a good way to assess it, and this is what the report actually looks like. This person has heavy metals on the increase, and these are good metals and minerals, and we have a healthy range for them. And this person is low in these and high in those. So we correlate that with the blood test and actually run this through a computer program in Dayton, Ohio. And we assess the health of the patient as to how their hair and blood analysis compares to thousands of other people who are also having hair and blood analysis done, but who are taking nutrients to correct their problems. So we're not comparing your tests with people who eat badly and take a lot of medicines, but rather people who are nutritionally oriented and are making strides with their health care based on change of diet and nutrition. Of course, chiropractic, herbology, acupuncture, and all the other natural modalities. Nutrients to help with high cholesterol are EPA and DHA, natural oils, niacin, chromium, and garlic. Nutrients for the heart, vitamin C, CoQ10, carnitine, L-carnitine, vitamin E, selenium, and magnesium. EPA and DHA, the omega-3 fatty acid EPA is the direct precursor. That means that's the molecules that makes the next molecule. Omega-3 is the precursor for the prostaglandins, which are involved in helping to maintain the body's normal inflammatory processes. Aspirin, for example, stops the prostaglandins from working. That reduces inflammation, but you don't always want to reduce all inflammation. Some you do. We need omega-3s to make the prostaglandins, which are going to be involved in our natural and good inflammatory processes. DHA plays a major role in the structural integrity of neuronal membranes. In other words, the covering of a nerve needs DHA so that it can make that covering correctly. Aging and carcinogenesis. Sirtuous. There's a link between the mitochondrial function, aging, and carcinogens. In other words, the mitochondria, which are the organelle inside the cell that is responsible for making the energy for the cell. There's a link between that organelle and cancer. Sirtuous-3 functions as a mitochondrial tumor suppressor protein. Damaged and aberrant mitochondrial function similar to gene mutations may be an early event that ultimately leads to the development of cancers, aging, and death. So what we're saying here is that sirtuous helps to suppress cancer formation due to aberrant mitochondrial function. Each cell has thousands of mitochondria, and if the mitochondria aren't producing the energy that the cell needs, the cell eventually dies. And this can lead to, this is part of our carcinogenesis, which is reversible by maintaining good mitochondrial health within the cell. This is my website, www.integrativealternativemedicines with an S.info. And this is my office here in San Rafael. If you go to this website, you will find lots of articles on a variety of different ailments. Perhaps your ailment will be in there, and you can read about it and the approach that doctors like me take. You might also click the link and look at the other TV shows like this one that cover a full range of topics, from Alzheimer's to cardiovascular. Like today, we do shows on cancer, gluten, a perfect health diet. We do shows on thyroid and the adrenal glands and the pancreas. It's actually quite detailed. That is my phone number, 415-847-5020. And I'd like to give special thanks not only to the Community Media Center of Marin for making this studio available, but also especially to my director, Evita Flores, who has been a great help in making these programs. Thanks for watching. I'd like you to spend a moment or two actually thinking about how much you're in control of the decisions you make about your health versus doing whatever you're told by the doctor that you see. It's come to the point with car mechanics that when we go in, we say, well, how do I know that I need that new part? Can you show me the old part after you take it out? Is there an alternative to doing this? Can I buy the part myself and bring it to you? Will that cost me less? People are doing this more and more with automotive care. Well, if you go into a doctor's office and they say, well, we need to order 4,000 in tests, we need to do a CAT scan of your entire body, you might just stop for a moment and say, do I really want a CAT scan of my entire body? That will be equivalent to 500 chest x-rays. Can I really handle that much radiation when I'm already not feeling so well? Couldn't I get an MRI instead, using magnetic resonance instead of x-rays? As far as getting a lot of blood tests, those are always safe to do. There's no harm in that. X-rays is probably the largest harm. But then it comes to the point where a diagnosis is made and now the treatment is being recommended. When the treatment is being recommended, you might think that the person you're talking to, because they're a specialist, that they know that the medicine they are prescribing to you is better for you than acupuncture or chiropractic or herbology or nutrition or homeopathic medicine. But they don't know that. They only know that that is the medicine that they know how to work with. Those other 5 modalities I mentioned, they don't know anything about. And you have to go to a chiropractor, an herbologist, a homeopath, an acupuncturist, etc., to talk to a specialist in those modalities of care. So just because a person is called a specialist in, say, endocrinology, does not mean that they're a specialist in all of the modalities that can treat the endocrine system. They're only a specialist in the allopathic pharmaceutical modality of treating endocrine problems. Keep that in mind, and keep the other modalities in mind so that when you make choices about your health care, you're being open-minded and you can get the greatest health benefit that you deserve. Thank you for watching the program. It's been my pleasure to talk with you. This show airs every Tuesday evening at 8 p.m. and I hope you watch them. Good night. Thank you. Nope, I'll do that one. It's all very weird.
That was good. Did you like it?
I did, except for my phone ringing. How'd you like that?
No, that was good. But I just switched to a different camera.
Oh, you did?
Yes.
Yeah, it's not the first time that's happened.
And then also when you were taking a sip, I switched it.
Oh, you did?
Yeah.
And the cough was getting to me. Did Janara arrive?